in the midst of its hearings relative to the wasted 44 million COVID vaccine doses, Mr. President. So my understanding coming from the good, Her Honor, is that there is a need to continue existing policies so that there will no longer be a perceived gap insofar as vaccination, implementation, and procurement initiatives are concerned. Am I correct in that aspect, Your Honor?
Actually, Mr. President, the point I was trying to raise is that when we are no longer in a state of calamity, the effect of certain provisions under various laws that we pass these certain provisions will no longer exist. And one of those provisions, as His Honor mentioned, is the negotiated procurement of COVID-19 vaccines. This is how we have procured for the past 2 years. This is how we have procured our vaccines. I am not making a statement as to whether this is the best way to do it, if we should change it. I am more than happy if there are findings, if there are recommendations that we change the way we procure. All I'm saying is that everything that we have done to respond to COVID, we will not have access to those. We will not be able to act in those ways anymore because there is no law giving those authorities. So one would be the negotiated procurement. The others would be the vaccinators that were authorized. These would be the pharmacists and midwives. Otherwise, they are not authorized to vaccinate. So yung rollout natin ng vaccines would be curtailed because remember, we had to pull out doctors and nurses and we had to authorize these other health professionals. The other example I gave was the authority of HTAC because it was HTAC along with the recommendations of WHO that said, even though we are just in phase 3 clinical trials, we will proceed. That was the practice all over the world. But even though it's the practice all over the world, we cannot do it here if there's no authority given. So that's all I'm saying, Your Honor, that we study this so that if there are steps that we need to take, and there could be new steps based on new findings, then let's be prepared to pass those laws so that we can make those responses that are necessary. They don't have to be the same.
Yes, Mr.
Sorry for
President.
the lengthy response, but I just wanted you to understand the context, Your Honor.
Yes, I now fully understand, Mr. President. But is the foundational issue now clear that we are no longer in a state of emergency, or are we coming out of the COVID-19 pandemic as part of a global reaction after 2.5 years that is no longer that we no longer have the pandemic right now, or it's about to end, soon to end? And
Well, Your Honor, I can respond to that by way of legal definition that allows the responses that I mentioned to take place, that allows government to take certain actions. We are not, because it was not extended. The last one was Proclamation number 57 on September 12, 2022, and it expired December 31. It expired on December 31, 2022. So yung legal effect ng pandemic, the legal effect of the calamity is done. But His Honor's question is right because WHO, as the international organization, has not yet made that declaration. Pero for us to act legally, it's not WHO. We passed our laws based on WHO and the determinations of our own government. So right now, we don't have it.
so, Mr. President, am I correct in dissecting the premise that the legal situation can be summarized into 3 or 4 aspects? 1, the procurement. 2, the effect of the non-extension of the state of emergency insofar as the actions of LGUs and national agencies are concerned. 3, the operations of the government. And 4, the private sector. So if there is no extension, For instance, if I go to number 1, procurement. Even if there is no extension, bidded out or negotiated procurements will still be continued. They're not talking about bivalent vaccines, those about to be delivered, especially those for the pediatric COVID-19 vaccines, among others. So will Her Honor agree that even if there is no extension of emergency, of the state of emergency, the four that I specified would not be drastically affected legally?
I'm not prepared to respond to that, Your Honor, because the response would be different. It would be different as to whether it's a drastic change. We can discuss that. We can ask the experts, which is precisely why I delivered this privileged speech so that it could be discussed. For example, like the procurement. Not an expert on procurement. All I know is that our practice is based on Government Procurement Reform Act, which requires that there's a public bidding. So precisely why during the declaration of this COVID calamity, it was determined that it would be faster to do the negotiated procurement. So as to whether there's a better way, and now that we know all the suppliers and bidding is easier, I really don't have any personal, at this point, I don't have a preference. I just know that in many cases, negotiated is the preferred manner to expedite the purchase. That's for the procurement. The other examples I gave was like the vaccinators that are used all over the country, whether it's LGU initiated or national government initiated. The fact remains, the delivery of vital healthcare services were curtailed because of COVID. A lot of doctors were even became frontliners, having to deal with just vaccinating and handling emergency cases. So we can't afford to be pulling them out. Studies show that there are so many cancer patients that did not receive their chemotherapy. There are so many dialysis patients that missed it. So we can't go back to that situation. We need to empower these vaccinators to do their job. Are there other ways to go about it? I'm sure there are. And having a hearing, and maybe DOH can suggest who else can be vaccinated. So again, I'm not saying that we go back to the way it was. I'm saying we need to be prepared, and in many cases, there may be a requirement for legislation act to ensure that we are prepared. On the quick response, perhaps His Honor would know better because precisely the quick response fund is a quick response funds na madali ngang i-access, no? So baka naman, hindi naman vital. Kaninong telepono yan? So as I was saying, baka naman there is no need kasi, but I don't know. Again, I'm not an expert in quick response. That provision was in the law precisely to already declare, hindi na to pagdedebatihan, access for quick response for the purpose of a COVID response is already given. It's already available. They just have to ask for it. So in that sense, it also made the process shorter. Yun. And then the other example I'll give is itong benefits natin to health workers. Malaking issue po yun sa kanila. Again, I'm not saying that they should get it, they should not get it. I'm saying if we are in the state of calamity and they are working overtime, exposing themselves, then it should be clear that they should get it. Eh kung wala naman, I also agree that di wala, but there can be provisions in law that we put in that perhaps the department secretary, which we do not have, we have an OIC, can make that declaration. Para klaro lang, no? So yun lang naman sa akin, Mr. President.
Just two quick questions, Mr. President. Is the IATF still functional or functioning right now from the...
Pag sinabi kasing IATF, and this is just a light response,
Yes.
si Secretary Galvez
Supposed to be on top of everything.
is already National Defense Secretary, and Vince Dizon is already in the private sector. Eh sila yung kilala kong IATF, plus of course Yusek Vergere, who's now our OIC. So kung meron mang IATF, and I think meron, not heard from them. But I think meron, di ba? Parang meron naman but I have not heard. I think they are busy with other things, which is good. It's a good sign. It means
We're back to
life,
normal.
we're back to normal. But my point is, and that is my job as the in-house self-declared futurist, I need to ensure that we do our part in preparing for that future, na prepared tayo to act. And
Because, yes,
yes,
Mr. President, because we used to have a daily
update.
briefing coming from an IATF spokesperson,
Yes.
updating the general public as to the current situation based on science, etc., etc.
Meron pa naman
So,
si DOH, Your Honor. I think they just speak as DOH, but I think not I think, I know DOH is a member of IATF. So siguro since parang we're not in that state of calamity, hindi na yung parang nakikita natin na live, di ba, live broadcast, but I still do receive my updates.
so we still have a vaccine, sir.
Hindi ko alam if we have a vaccine, sir. That I do not know. I just know that I know that the DOH gives update on the COVID cases.
What about, Mr. President, recognizing the expertise of the various LGUs? And LGUs under the local government code are empowered to declare their own state of calamities. So are we now saying that because of the absence of the extension in that state of calamity declaration, LGUs now are empowered based on the situation on the ground on whether to have their own local state of calamity concerning COVID-19, and it has now highlighted their functions under the local government code. Is our honor willing to accept that? That even though the national government is silent, the LGUs are still functioning.
Actually, Mr. President, that is an interesting idea. This representation always has an open mind, but being a lawyer, we are governed by laws and section, for example, lang, no, one example yung binanggit kong health emergency benefits ng ating health workers. That law specifically states that they would get this during the COVID-19 or other public health emergency of national scale. So they will not get that, I believe, under the local declaration of calamity. As to the ability of LGUs to authorize a pharmacist or a midwife to vaccinate, parang yatang, I'm not sure if they also have that authority. On the vaccination program pala, sorry, to be very clear, the law that we passed, which allows these professionals I mentioned to vaccinate, it refers to a declaration that the period of the state of calamity by the president exists. So, ganun ka-specific yung authority na binigay natin, and effectively, this authority no longer exists.
But, Mr. President, I can still recall that during the midst of the lockdowns, various local government units were in conflict with the national government's decision. Cebu, for instance, would have its own COVID-19 policy relative to lockdowns, checkpoints, etc. The same is true with certain LGUs in Mindanao. So is it now the appropriate time, given the relaxing attitude of the national government, to really, as I said a while ago, to really recognize the different LGUs as under the local government code again, under the General Welfare Clause, Section 16 of the local government code, as to have that delegated power to implement what the national government now is not doing. So, in effect, there is no lacuna, there is no vacuum here. What the national government has been doing before has been transferred to the local government units, and the effect would still be the same. Sans, for instance, the benefits given to the nationally employed nurses, pharmacists, etc. But in terms of the effects on the populace, it's still the same, or it can be better. because the local government units would know the real score on the ground. Ilan na ba yung nabakunahan? Ilan pa yung nagkasakit? Sila rin naman talaga yung nagtrabaho. Sila yung humarap sa COVID-19. It's not the national IATF. It's not the vaccine czar, no offense to them. It's the governor. It's the mayor. It's the barangay captain. It's the barangay health worker. These were the real heroes. Sila yung araw-araw na humaharap, nagbibigay ng ayuda at nagbabakuna. So, Mr. President, my theory is this. Kahit po nawala na yung policy, kahit nawala na extension, we should not worry because the LGUs are there. Section 16 of the Local Government Code is being operationalized by the various LGUs. Am I correct in that premise, Your Honor?
Your Honor, Mr. President, our colleague made statements that I wholeheartedly agree with. The LGUs were the frontliners in dealing with COVID-19. My own brother, Lino, former mayor of Taguig City, I saw through his efforts and the efforts of Metro Manila. I speak of Metro Manila only because I'm from Metro Manila, no? But of course, the efforts of mayors and LGUs all over the country were very similar. Talagang literally buwis buhay, Your Honor. I have no arguments there. They deserve all the commendations. They literally risk their lives, no? You're right, Your Honor, yung pagbigay ng ayuda na nagkagulo-gulo. LGU naman ang nagbibigay. Sila naman ang may alam kung sino yung kailangan tumanggap. I agree with that. But we cannot change the law, Your Honor. I'm not aware that the LGU, the local government code, effectively amends our national laws that for health reasons only allowed certain persons to vaccinate. No, I agree with this owner wholeheartedly that they will be the one to determine na, uy, parang dumadami, uy, malala, di ba? Marami pa lang na ano. And then let's say internationally, merong bagong drug na develop. So can they procure on their own? They can. Your Honor is correct. We have enough laws that allow them to do this. But Your Honor will recall, many of these LGUs also entered into their own contracts and they happen to choose a supplier, if I'm not mistaken, na ang tagal dumating. Dumating naman, pero dala ng supply and demand, yung brand na yon na naglumapit sa lahat ng mga LGU, ang tagal dumating. So like in the situation of Taguig, and I hope I'm recalling this correctly, by the time na dumating yung supplies ng mga companies, pati nung Taguig City, the national government already provided naman. And in fact, months later, and perhaps our colleagues can have the same experience, tumatawag yung mga companies sa amin asking kung saan nila pwedeng i-donate yung kanilang vaccine na binili kasi nabakunahan na lahat ng tao nila. So I'm talking naman about private, no? But my point is, may role pa rin ng national here and I don't position myself as the expert. I just feel that this is ripe for a discussion. The national government can initiate it. It can be the IATF that initiates it. Perhaps a hearing. That's why I want this referred to the Committee on Health so that clear lang naman sa atin. What happened, His Honor will agree, will recall on March 23. Tinrabaho natin, pinuyat natin yung bill natin on the declaration and the Bayanihan Act because we had to act urgently. Sana hindi na tayo dumating doon. Tsaka, I mean, we did our best, di ba, given that the limited time that we have had. But, yun nga, we have lessons that we have learned. So I just want this to be studied carefully. We can probably have even a better response, Your Honor. And His Honor is absolutely correct in saying that perhaps a lot of this can now be relegated to the LGUs. They had the opportunity to shine, and they did shine. They are experienced now. A lot of this they can handle. Pero siguro, Your Honor, like yung pag-analyze nung mismong effects nung which drug is better, we rely on the national government pa rin for that, no? And since His Honor, last point I want to make is has his own hearing on what lessons can we learn from these negotiated contracts, we'd be very happy for that to be included in the discussion. I just know that this is usually the path taken to expedite when procurements have to be done more rapidly.
I totally agree with Your Honor that the rites of passage especially during those dark pandemic
Yes,
days,
yes.
was difficult. But I can still vividly recall and having opposed the tripartite agreement schemes being proposed then by the IATF. Sana nabigyan na lang ng greater roles ang LGUs. But lessons were learned. Perhaps we won't be facing another pandemic in our lifetime.
Actually, we will,
Perhaps
Your Honor. Sorry to interrupt, pero the
there is
science
another one.
tells us that the
There's
chances of
another one.
in our lifetime, no? The chances daw are highest. Sana nga hindi.
we have learned. We have called from some from the lessons, and I think Her Honor is correct that there should be a standby
Authority? Something
authority
like that, yeah.
given to the national government, and at the same time, recognize the role, the bigger role being played, supposed to be played by the LGUs as the frontliners. So, yun lamang po, Mr. President. I have no further questions, and I thank the gentle lady from Taguig for having raised again this very relevant current COVID-19 issue, which is still lingering in our midst. Maraming salamat po, Mr. President.
Thank you, my
Thank
distinguished
you,
colleague.
Mr. President. Mr.
Thank you,
President,
thank you.
yeah, our distinguished Deputy Minority Leader, Senator Risa Ontiveros, would also like to propound some questions.
distinguished-
I move that she be recognized, Mr.
Our
President.
distinguished Deputy Minority Floor Leader, Senator Risa Ontiveros, is recognized.
Salamat kayo, Mr. President. Actually, not an interpellation of the gentle lady from Taguig and Pateros, but a manifestation in support of her privileged speech. We also already raised this concern, Mr. President, and its implication for the COVID-19 vaccination program and benefits of healthcare workers. So as far as we are concerned, the COVID-19 pandemic situation has not been downgraded, and the public health emergency still exists. Matagal na po nating pinanawagan na bigyang pansin ito. Yet, unfortunately, the Department of Health opted for a legislative track to the umano balance health and the economy. Parang nangyari po, Mr. President, sa atin sa Kongreso, pinasa ang responsibilidad na mas madali sana kung inaksyonan na lamang ng Malacanang agad. Ni-raise po natin ito, Mr. President, gentle lady from Taguig and Pateros, noong September 2022, and even during the budget deliberations. So salamat kaayo, Mr. President, and thank you to the gentle lady from Taguig and Pateros for again raising this important matter to our attention.
Thank you, Your Honor. We appreciate the attention and concern Her Honor has. Thank you.
Thank you very much.
Thank you, Mr. President.
Majority Leader.
With that, I move that we refer the privileged speech of Senator Pia Cayetano and interpellations to the Committee on Health and Demography as the primary committee, and secondary committees, Committee on Sustainable Development Goals, Innovation, and Future Thinking. So move, Mr. President.
There being no objection to the motion is approved.